10 News investigation. When you hear someone say prescription drugs, what's the first thing that comes to mind?
Well, the answer for a lot of people certainly would be prices. According to a recent report in the journal Health Affairs, the cost of brand name oral prescription medications went up more than 9% a year between 2008 and 2016. Injectable meds went up 15% a year during that same time. In fact, rising drug prices have outpaced all other health care spending in recent years, including nursing home costs.
For the next 3 nights, David and I, along with our political analyst, Dr. Brian Calfano, will take an in-depth look at the problem and possible solutions.
Now, Heather and David, in 40 states, pharmaceutical pricing bills are either pending or have already passed. So we'll be taking a look at what Missouri lawmakers are doing to help legislatively with bringing prices down for consumers.
I'm exploring the business angle and how companies balance profit with the priority of providing good health coverage.
But we're going to begin our special series tonight by crunching the numbers for you, sharing the all too common story of one woman who struggles to pay for her monthly meds, and we'll give you a closer look at some local resources that help people pay for the medications they can't afford.
Yeah, everyone in my household is on medications. So.
Kathy Lutz and her family live on a fixed income. Lutz has faced cancer, heart failure, and a variety of medical issues in recent years. As a result, she's now on 17 different prescription medications.
This one is an everyday med. I have to take it twice a day.
She and her family qualify for health and prescription coverage by the state through a program called Mohealthnet. If she didn't have that, Lutz says she couldn't afford her monthly meds.
Rough total, not counting the over-the-counter stuff, is $1,187.35.
Every month.
Yep.
Lutz calls the price of prescription drugs outrageous and wonders who's profiting from the payments.
And I do understand that a part of the money that you're paying for this drug goes to research other drugs. But there's an upper end limit where common sense just tells you it's plain greed on somebody's part.
Some people blame skyrocketing costs on something called a pharmacy benefit manager. That's a company that manages prescription drug benefits through employer-sponsored health insurance plans. PBMs claim to save you money by negotiating deeper discounts, but some insurance industry analysts claim that drug companies simply raise the prices to offer bigger discounts to those PBMs. These numbers from National Health Expenditure data, though, don't seem to show discounts or lower prices at all. Total spending on prescription drugs in the United States was $333 billion in 2017, an increase of 41% from 2007, when those same costs were just $236 billion.
And so if you look at the news, you'll see that places like Arkansas and Ohio and other states are really pushing back against those PBMs.
Brandy Bowers is a clinical pharmacist at the MSU Care Clinic. This facility, opened in 2015 as a partnership between Missouri State and Mercy, is on the front line for people who can't afford prescriptions. The clinic offers free care to those with no insurance. That includes free prescription medications.
But once they're enrolled, any medication that's on our formulary, which we get meds through several access points, they can get for free through our clinic.
Bowers says some patients at this clinic can need upwards of 12 or 13 prescription medications a month. While uninsured patients here get those meds for free, the costs can add up fast for anyone.
For a patient who's managing several chronic disease states that are fairly common, if you start talking about diabetes and a heart disease and something else, that can add up easily out-of-pocket cost to over $1,000.
We get about 10 calls a day for people needing help with prescriptions.
Jeff Smith with the Salvation Army in Springfield says the agency has offered prescription assistance as part of its emergency social services program for many years. There's no income cap to request help from the Salvation Army. The benefit is capped at $50 per person per household if you qualify after speaking with a case manager. However, this program will not pay for narcotics. Last year, 142 households in Springfield used the Army's prescription payment program.
Well, I've seen people in tears. They say they've gone everywhere else they know to go to. How would you feel if your doctor wrote you a crucial medication and you just spent your last $50 on groceries until payday?
But indeed, that's a harsh reality for a lot of Americans, people who simply can't afford the medications they need to live. Kathy Lutz says that very scenario proved fatal for one of her own neighbors.
She ended up dying because she couldn't afford cancer treatment. It was a needless death. It didn't need to happen. There were medications that could have at least slowed it down, but because she couldn't afford them, and it just, It breaks our heart.
We should mention the president and members of Congress on both sides of the aisle may take some action this year to try to help lower the high cost that you pay for prescription drugs. One consideration on the table is capping out-of-pocket costs for people using Medicare's Part D prescription drug program. And of course, we're going to stay on those developments and let you know exactly what happens. And I know, Heather, you've got the next installment in our 3-night series coming up tomorrow night.
Yeah, that's right. And as we know, Springfield has a wealth of small business owners, but as an employer, it can be challenging to provide good health insurance. We'll show you how some local businesses are tackling that problem.
That's tomorrow right here on our News at 10.